Oxford Medical Simulation is the world's leading provider in VR training for healthcare professionals. We work with healthcare institutions, universities and nursing schools across the world to provide VR training for their learners. We are really proud today to have brought together our leading partners in the UK across nursing schools, universities and healthcare to run a roundtable event of discussions and collaboration.
So we started during COVID because we had to for placement expansion, and it's been a long journey trying to get staff to buy in, understand what virtual reality is, but actually we've embedded it across our curriculum and every nursing student gets this before they go out on placement, and it's a fundamental part to make them confident, secure learners and have a really great practice learning experience.
I think some of our successes using VR, and I'm going to use one student in particular who'd done a placement within an accident and emergency department, and then when they were going through the scenarios, actually said, I've learnt more doing the scenarios than I did on placement. And we had a chat about that because I was like, how is that? But it was because they had to think for themselves. They had to make their own decisions, and they weren't relying on a practice supervisor or a practice assessor to guide. They had to learn from those decisions as well and then go back and improve that care again to get a higher mark within it, but it helped them learn and it gave them confidence in actually that they could make the right decision as well.
All virtual reality that's used within simulated practice learning is usually contextualised into practice learning experiences that are about real people, real care, and they obviously need to meet all of our standards of practice learning and standards for students' supervision and assessment as well.
So I think the fact that our first year students have an opportunity to explore their confidence levels in doing basic skills and talking to patients, that fundamentally is a success story in clinical decision making, because they're able to go into practice for the first time, be confident, competent and feel really happy doing what they're doing.
So it's really important to bring those early adopters of VR technology with people who are thinking about implementing VR or maybe haven't implemented it at scale. That way we can learn from each other's mistakes, successes, and help nursing schools to really successfully and effectively implement virtual reality technology in their programs.
So we tried to ensure our students really engage with VR Sim in terms of we introduce the whole process as a placement. So our students would arrive at placement on time, etc. So it is about the professional values around that. So we set the same standards.
Hands-on experience in a way that means they go out being safe practitioners for their first placement. So traditionally students were really anxious about going out on their first ever placement, and we lost a lot of students in that first placement opportunity because hands-on care is actually quite scary. This gives people an opportunity to practice talking to patients, doing things in a way that's actually safe, and they can make a mistake and keep going until they get it right, rather than having an impact on someone's life.